Thank you. Okay, good morning, everyone. Welcome to our York County Community Sector Briefing. It's Thursday, May 14th, I believe. Just as a reminder, this video is recording. We do intend on releasing it later, so if there's connection issues on anybody's end, it should be out on Facebook later today, up on YouTube. If you have questions, you can type them into the chat session. We will address them either on the chat or one of us as a speaker. And otherwise, you can raise your hand as well. And I would like to introduce Laura McDougall, Director of Four Corners School District.
Good morning, everyone. I want to start off by giving a little report about the total cases in Nebraska today, this morning on the DHHS website. They were 9,075 with 107 deaths. It looks like Douglas and Hall County today are at their highest, at the highest levels or numbers in terms of positives, COVID positives. We're also seeing lots of cases in counties surrounding us, such as Hall, Lancaster, Saline, Platte, Colfax, and Adams. So we definitely have a lot of cases around us. So this morning, to give you a little update on what's going on around our own district here, we had 4 new cases overnight to bring us up to 81 cases in the Four Corners district. The 4 new cases happened to be in Butler County. So, but yesterday York did have 3 cases. So as of right now, York County has 26 cases with 12 recovered. We have Butler County at 27 cases with 7 recovered, Seward County 19 cases with 8 recovered, and Polk County 9 cases with 9 recovered. So right now Polk County is does not have an active case. We also had the 1 death in Seward County. Total for the district, 36 recovered. We think this is a little low though. We have been busy following up on the positives, and we still need to get that number updated. So it should be higher than 36 recovered. Currently, we have 4 people in the hospital. And now this is district-wide, and because I say hospital, it doesn't necessarily mean that they're in the hospital in our counties. They could have been transferred out of our counties and most likely have been. We also have 2 on a ventilator. We have currently over 100 people in quarantine that we're monitoring daily. So one change we're instituting as of yesterday, today, we are going to be reporting out on our numbers. We've been issuing press releases daily, and now the numbers are really getting up there to where I don't know that it's really news. We have numbers now, and we're going to just start doing Monday, Wednesday, Friday to be releasing a press release about what our numbers are. So just kind of get ready for that. We will have all of our current numbers though ongoing daily on our website at www.fourcorners.ne.gov. So you can at any time go and check what the current numbers are on our website, and so be aware of that if you need those numbers for any reason. Okay, so I also wanted to talk about the directed health measures. We're still under the same directed health measures that are effective through May 31st. And again, just a reminder, that's that 10-person rule for gatherings. And there has been some new guidance released on our website, and it's on our website. It's regarding youth sports and specifically baseball, softball practices and things. So, and what's being planned for June 1st. So if you need to access that, again, it's on our website. And just remember that we're still on that 10-person rule. The National Guard testing, I wanted to report about that. It was last Friday. A total number of positives that we had from that event were 13. We did 202 tests at the National Guard event with 13 positives. One of those positives was outside of our district, but 12 were within our district. So that's still a pretty low positivity rate for that number of tests. We still have 2 tests we haven't gotten results on. So we've gotten results now for 200 of the 202 tests, but we're waiting still for 2 more. Now I'd like to turn it over at this point, Jenna Clark, my emergency response coordinator. Would you like to give a report on personal protective equipment?
Hi, Laura and everyone. We have been working on getting our PPE shipment into inventory and packaging that up for all of our entities. And the gowns that we received, they were labeled as disposable aprons. And so they're not, yeah.
Jenna, we're having trouble hearing you. You're cutting out really badly.
Okay.
I hear what you're saying. Maybe I can just paraphrase and we can figure this out for our next briefings today. You're
okay.
Cutting out really bad. Okay. Jenna was saying we have received quite a bit of PPE in the last week or so and have been trying to get it out the door. Sent a lot of PPE out the door. One of the issues we had was the state shipped some gowns to us that weren't really, they're very inferior quality. So they're very, they're blue aprons and they're very flimsy plastic. So I believe at this point they've reordered, they're trying to replace that shipment with some better quality gowns. So stay tuned. And if you have any questions about that, please just contact our office and talk to Jenna. And she'll make sure that you have the information you need. Okay, so I think that's all I had for my report this morning. Thank you.
Thank you very much, Laura. Okay, we'll move on to the local government sector. Did you say Barry's on? Okay, it looks like Barry is on. Randy, if you're there and we just don't see you, you can speak after Barry. Barry, are you available?
I am available. Just a couple of comments. Good morning. As Laura said, they came out with some new rules about baseball, softball for youth. Cherie is reaching out to all those coaches and leaders of all of those leagues to talk to them about what their plans are, and see there's quite a list of things that you have to do to make it happen.
Barry, hold on a second. I just connected from the Wi-Fi. It must be our end and not Jenna's. Okay, try again.
You want me to start over? So good morning. But anyway, as Laura said, there's some new rules from the governor on youth baseball and softball. So Cherie has immediately gone out and contacted a lot of those leaders, coaches of all of those different things to just see what their plans are. There's a lot of rules that would have to be followed. So we're not sure where we'll
Coming
go.
in fine here. Okay.
We're still trying to figure out, we're looking at our council meeting on the 21st, which is next Thursday, and trying to make some decisions when it comes to what we're going to do, what we'll do with the ball fields, what we'll do with the pools, with the pool. We've been talking to all of our different department heads, whether it be Deb at the library or Cherie or anybody, or Terry, you know, talking to their peers, you know, about how things, if they do have an opportunity to open and win, how they would do that and what that would look like. So as I think, as is kind of the story, there's just a lot of uncertainty and questions about everything as it goes forward. So it does become a kind of a day-to-day thing to try and figure out. But we hope by by the council meeting, we're going to have a discussion on this and let the council weigh in and talk about kind of what we think. But right now we're doing our background work. So other than that, the city buildings are going to stay closed through the end of the month, and then we're going to redetermine kind of what things look like then. So that's really all I have today. Thank you.
Thank you very, very much. Randy, did you come on?
Yeah.
Okay, Randy, thank
Morning,
you.
everybody. Well, it's kind of business as usual for the county is concerned. I feel hesitant to give a date that we're going to open things up, because it seems like when I say a date or say a possible date, it doesn't happen, and then the phone calls come in. So I would say kind of stay tuned. I would tell you that we're operating and operating fine. Obviously, our election numbers were big for this area, and that was taking place pretty much remotely, as the numbers to the polls were really down, but the numbers overall were huge. I would tell you that as far as the county is concerned, the county courthouse, through all this, we was one of only 6 courthouses in the state of Nebraska that essentially remained open. Even though the individual offices were locked, the courthouse was open through the whole time. And now I looked at the website yesterday, and we're up to 11 courthouses open across the state. So it looks like we're taking some measures to start reopening. Everybody's got their own ideas on how that should happen and what precautions should be taken. We've already started taping on the floor. I think everybody's aware of that. They see it in most businesses they go into. So it's coming. Not sure if it's going to be next week or the week after, but we'll sure let everybody know. Up until then, obviously you can contact any office you need to, elected official, and deal with most of those things either online or over the phone. And like I say, we'll just keep pushing forward. That's all I got today.
Thank you very much, Randy.
Benedict's on and Aubrey's on.
Okay, Village of Benedict, do you guys have anything to report today? Okay, what about Henderson? Aubrey? We know you're on. Do you want to report anything today?
Actually, Lisa, I will be the one.
Okay, Connie.
This is Connie, and we had our council meeting on Tuesday night, and as far as the swimming pool, we're kind of waiting to see what happens around us. We'll revisit it again at our June 9th council meeting. The ball season, we met with the rec committee last night, and they've been meeting with the league that we're in, and so we're determining right now, June 1st, we're going to look at doing some practices, but following, of course, the health measures, possibly just doing interlocal playing or glorified practices. The community days we're still unsure on, but the council did say we're still going to do our fireworks show on July 11th, which is a Saturday. As far as the offices opening, we're still trying to determine. It probably will be May 31st, but we'll just kind of wait and see what happens there. So that's what I have to report.
I was trying to get my video to work, and now, hi. Thanks, Connie. Yeah, Connie pretty much gave the update for me as well. Our hair salons are open by appointment. Perks, the dining room is still closed, but she is doing a lot of takeout. The farmer's market will be starting the 2nd with some, everything will be spaced out a little bit more, but that's still a go. And I just heard around the community that people are excited for something to do. And then I have a board meeting next Thursday where I think all the board members are in agreement that we'll decide what community days is going to look like, whether that's a postponement, a cancellation, or a modification, just what it will look at, what it will look like and what it will entail. But as Connie mentioned, the fireworks will happen. That's pretty much all we got. We're just in the waiting game like everyone else.
Okay, thank you, Aubrey. Are there any other communities on that would like to do a brief report?
I'm Stephanie, I'm with Bradshaw. I have a quick question. We have canceled our community days. We just decided it wasn't worth it. But the one question the board has is on our community center rentals. We still have some on the books for like June and July. How is everybody else handling those? Are you guys making people cancel those, or are you guys gonna let them go on?
Just community.
I'm gonna call Laura up.
Hi, so it's our information that community, and we're having a little reception problem here, but you're asking about community events, correct?
No, like our community center.
Community centers. Okay.
We rent out the community center and we have some on the books for June and July still. And the board is wondering if we should even allow that.
Okay, so, you know, that is something that's really still up in the air. The governor is coming out with, will be coming out with new directed health measures as of June 1st.
Okay.
And at this point, we're not sure what they have planned for the numbers that can gather together. I would stay tuned. As soon as we have any more information about that, we will share it with you. Just not sure what that number might be. You know, they're talking about gradually relaxing numbers and gathering numbers, still with social distancing. I think there's a lot of things going on right now with our cases are starting to get higher. They're really watching hospital capacity especially in Lincoln and Omaha, and in our bigger hospitals that do have intensive care units and ventilators and things. They're watching what's happening there and how we're faring. We know that our numbers are still going up, so but I think they're still planning to relax some of the restrictions. So I don't know if it'll be, you know, what those next numbers will look like, if they'll be 50 or 250, what that'll look like. But I don't anticipate we're going to see really large numbers right away for events in June and July. So thanks.
Thank you very much, Stephanie. Any other communities? Okay, and for those of you that are still on Facebook, we will be posting the recording of the video as we move forward. Okay, we'll move on to the medical sector. Jim, you are on. Are you still available?
Yes, I am. Good morning. Laura, I know you talked well about the fact that typically the COVID-19 positive patients are not hospitalized within the district, or if they were, they've been transferred. I will typically report to on these type of calls whether we have an inpatient or not, and we do not have any positive COVID-19 inpatients at this time. So I'll just report that here. So they're not in York County, as kind of you alluded to. We continue to do more and more on-site testing here at York General. And I reported in some other calls that we've scheduled these at certain times in the afternoon so that we can do a quicker turnaround through the Quest labs. And we've had really good turnaround on those tests. Sometimes they've been within 24 hours. And just as an example, yesterday through our scheduling, we had over 10 individuals that were tested through our drive-through testing. I mean, they would call up through the ER and schedule a time just to come in, and we would, they don't have to step in our facility. As they drive by the back, we have full PPE on our practitioners, and they go out and test the individuals out there in their cars. So that seems to be working well and getting busier. We hope to, in time, be able to use some of our rapid testing equipment that we have in the hospital. We call it BioFire is the name of it, and we hope to sometime in the first part of June to be able to employ that, which would mean even quicker turning around of our testing. So we are looking at changing a little bit our protocol on, it's not finalized yet, but looking into changing our protocol on our surgeries and going to testing as a part of their pre-op procedures, testing all individuals for surgery, meaning testing them for COVID-19 ahead of time. That's a deviation from when a lot of us have started as smaller hospitals, but as testing's become more available, we're gonna look to do that as a part of that preoperative procedure, as well as having them isolate before surgery. And we're kind of following Bryan Health and CHI and UNMC in this change. So we are continuing with our elective cases and procedures and continue to go well. Our PPE levels are fine at this time. Our hospital capacity is fine at this time. You know, continuing to listen for any changes and better shipment of gowns in the future, but we understand where that's at, and Four Corners has been communicating that well to us at this time. It is both hospital and nursing home week this week. And they don't always line up together, but they do this year. And so we are doing some events, you know, albeit they're different than gathering a crowd, but we're doing some events for our team starting today and then tomorrow and then next Monday. And then toward the end of May as well, we're going to have more of a drive-through family pickup. It used to be our picnic, but we'll be doing on a drive-through basis coming up. So trying to celebrate as we can. For our hardworking staff. And then finally, CMS is putting out some additional waivers, and we're looking into which one can comply with us. So during these times, it's some relaxed regulations and how we can take advantage of that to better serve our patients in need at this time. And so thanks for the opportunity to report. That's what I have today.
Thank you very much, Jim. Okay, can you hear me now, Jim? Okay, thank you. Okay, we're moving on to the business sector report. We're having some technical issues, as you can tell. I only have a couple of things to report today. We have the York County Business Impact Assessment Round 2, the survey to kind of measure where businesses are going every few weeks. If you did not receive an email from us, it is on our website, not our website, on our Facebook page. I posted it this morning. And you can always call me and I'll email you the link directly. I want to encourage you, if you need assistance, to reach out to me. And I'll be able to guide you the right way, connect you to the right connections. And then, not really COVID related, but we have been getting phone calls regarding when York Creekside Apartments are going to be open. We're looking at sometime in June for the first building. If you're interested, you can call Mary, who's the property manager, at 308-946-3826, extension number 2. And I'm going to turn it over to Rhonda for her side.
Good morning, Rhonda Velba with the York Chamber. A couple announcements. This evening we will have a virtual shop party with downtown York businesses. Each one of those businesses will be going on their own Facebook Live pages, and they're going to be doing a shopping event. So we encourage you to join on and follow along, see what they have to offer, and jump from page to page. And if you're not available to join at 7 o'clock, those videos will be posted and you can join and watch those videos at any time. The York Farmers Market will be happening this summer. It will look different than in past years, but stay tuned. We will be giving more information on that as it gets a little closer. We had a question about the blood drive. The blood drive is still happening. It is May 26th at First Presbyterian Church from 8:30 to 2:30. The Red Cross needs blood more than ever, so we do encourage you to sign up. I believe they will not take walk-ins. I think they encourage everybody needs to have an appointment. So if you can go to their website and sign up, and they encourage that everybody has a mask. If you don't have one yourself, they will have one to give to you, and they will take temperatures as you arrive on the spot, and just encourage you to follow the health guidelines of socially distancing while you're there.
Thank you, Rhonda. Are there any other businesses on the call that would like to say something at this point? Okay, if not, we'll move on to education. Brad, are you available from Heartland? Okay, I know Southeast Community College has nothing. They've texted, or not Southeast. Southeast Community College. Did you say your college? Okay. Mitch from York Public Schools did email a report. He's not able to join on Zoom today due to a meeting at the school. His update was going to be that students' last day is Friday, May 15th. And the governor said weight rooms could be open with restrictions. They are currently putting their plan in place to open our weight room on June 1st. And they can only have 10 or less people in each room for lifting and supervision. There can't be any sport-specific drills at that time. For example, they cannot have a basketball team in the gym working on basketball skills. And YPS will continue to work with Four Corners as restrictions changes. And is McCool Junction or Northeast Nebraska Lutheran on the phone? What about your college? Okay, then let's move on to the faith sector and nonprofits. Erin, are you still on?
Yes, I am here. Good morning, everyone. Want to draw your attention to a couple of resources in the community. Resources still continue to be available to support households during this time, and of course after COVID-19. East Hill Church of Christ continues to take appointments for their clothing, free clothing exchange drive. That number is 402-366-6534. Again, that's by appointment only. We also have been hearing a lot about WIC, Women, Infant, and Children, and that is available to parents, guardians, foster parents of any gender, male or female, with a child under 5 years old, and all foster children under 5 are automatically eligible for WIC. So that's another resource that families can get in contact with. They have now moved from the checks to a debit card type system, so it is easier to get through the line and things like that. Our local WIC office is located in the Blue Valley building, so you can contact Blue Valley for that. I do want to make you aware that our COVID-19 response fund continues to take applications for families that are needing support with emergency assistance, either with rent, utilities, food, childcare, things like that. So things that are connected to the household. Also, if you've been listening to the governor's press conferences, you've heard him mention community collaboratives. Just want to make you aware that York County Health Coalition is one of those collaboratives that does work with Suzanne Shore and her group. So every Thursday after this meeting, actually, Suzanne Shore does jump on a call with many of us from across the state to talk about what we are seeing, what we're experiencing in our areas. Several of you got emails from me last week about connectivity and computers, tablets, devices like that. And you heard Suzanne talk about that earlier this week. So that was part of that. We also are working with other community collaboratives, knowing that there are several counties surrounding us that do not have community collaboratives. So do just want to make you aware that if there are individuals from Polk or Butler who are in need of some help, we offer resource navigation. So we do work with communities like Columbus and Schuyler, Grand Island, Lincoln, to help get individuals to those resources that are either closest to them or in the communities that they feel most comfortable and connected with. So please don't hesitate to give us a call. Our office number is 402-745-6604. People can also fill out our application online, which is at www.yorkcountyhealthcoalition.com. That's another way to get in contact with us. And then lastly, just again, reminder, it is Mental Health Month. So just want to encourage you today to take time to just breathe. Do some deep breathing, take a couple of breaks today, and just kind of recenter your mind because we might get through this.
Thank you very much, Erin. We did get a message that DHHS has nothing to report at this time. Are there any other nonprofits on? Okay. Then I am going to call Laura up. Melanie with York News Times has a question for her. Do you want me to read it? Okay, has there been a significant number of people who tested positive in a particular business in York this week? And if so, is there further information about that situation and or if it poses any risk to the community? Laura?
So I'd like to go ahead and give an answer to Melanie about that question. Really, I would like to address that from a district-wide perspective. We have different ways that this COVID is being transmitted right now in our district. We do have community spread, cases of community spread occurring, where we know that we don't know where they got it. So they're picking it up somewhere in the community we haven't been able to really track it down specifically where they got infected. We also have cases where workplaces, people are catching it at their workplace because there are other cases there. And by the time the tests come in, we've had further spread by the time we know that there's actually a positive. We do have cases of people that are showing no symptoms. So that's where that gets really tricky. We also have a lot of cases where it's families or someone will take it home and infect their family or their household contacts. So we really have all three different types of things going on. Yes, we do have some businesses all across our district who in different counties that we're seeing some transmission happen. But at this point, I wouldn't say that it's a significant number. Yeah, it is happening though. And that's really all I can say at this point. So we're really busy doing that contact tracing and trying to get people into quarantine who might have been exposed to stop that transmission. So I hope that gives you some more information, Melanie. Thank you.
If you have any more questions, please type them into the box and we'll respond. Okay, Cindy Nickel just asked me to share the Red Cross is having a blood drive on May 26, 8:30 to 2:30, and it is being held at the First Presbyterian Church. They have implemented several safety practices to help keep donors safe. They are in need of blood more now than ever. Please sign up to donate. You can call Cindy Nickel to schedule or sign up at redcrossblood.org or use the donor app. And Cindy said, thank you so much. Are there any other questions or reports at this time? Okay, we will wrap this up. Thank you so much for joining us today. And we will be posting this video out later, and have a great week.